This segment is sponsored in part by UnitedHealthcare.
The last 2 years have been a trying time, not only for the nation, but for people here in New York. The United Health Foundation just released their latest America's Health Ranking annual report, which features a detailed picture of America's health during the pandemic. Joining us now is Dr. Rhonda Randall. She is the Executive Vice President and Chief Medical Officer of UnitedHealthcare, to show us where we're succeeding and where we can improve. It's so great to see you again.
Thank you. Glad to be back.
So first things first, what can you tell us about this report?
Well, this is the 32nd edition of the America's Health Rankings annual report. It's published by the United Health Foundation this year in partnership with the American Public Health Association. This report contains 81 measures of our health from more than 30 different public health sources. And as you just mentioned, it includes new publicly available data that provides a comprehensive look at our nation's health. And we're also able to see how we're doing at a state level and break that down even further by geography, by age, by race and ethnicity, by income level, gender, and more.
So what can you tell us about all of us here in New York? What are some of our strengths when it comes to health?
So New York reported some significant successes. First, a low premature death rate. This is important. You're ranked third in the nation, in the country, and well below the national average. Another strength for New York is a low rate of adverse childhood experiences. This is a percentage of children who have experienced 2 or more stressful traumatic events during childhood that could have a lasting impact on their health and well-being. So some of those experiences are things like parental divorce or separation, neighborhood or domestic violence, being treated or judged unfairly due to race or ethnicity, the death of a parent, among others. And finally, another one I'll mention is New York achieved a high per capita funding for public health. We know that's important, especially during a pandemic.
Let's look at the 180 of that. What are New York's health weaknesses or areas where we can improve?
Well, on the other hand, one that might not surprise you is frequent mental distress in New York increased 8% between 2019 and 2020. New York also struggled with a high rate of severe housing problems. 23.3% of occupied housing units have at least one of the following problems: a lack of complete kitchen facilities, a lack of plumbing facilities, overcrowded. So that puts New York in 48th place for the nation for that measure.
Wow. So what do you think some of the solutions are to some of these issues that we have here in New York State?
With regarding to housing, there are certainly ways to prevent and minimize the impact of housing problems on health, but this is something that really does deserve multifactorial attention from public health officials, from policymakers, and from community leaders.
So I know we're talking about New York State, but I wonder if you could tell us what you have found nationwide. What are some key takeaways there?
Yeah, the most notable finding in this year's report is when we looked at 2019 compared to 2020, we saw the nation experience a devastating 17% in the overall death rate. Of course, we know that a significant amount of that was due to the pandemic, but it is more complicated than that. We saw also an increase in drug deaths in a similar period of time, and we know that deferred care for chronic conditions and sometimes the avoidance of screening during the pandemic may also have impacted those numbers.
Dr. Randall, if viewers would like to read more of this report, how can they find it?
It's on our website, americashealthrankings.org. You can find all of this information on that website.
Fantastic. Chock full of information. Thank you so much for your time.
Thank you. Be well.